I want to turn to the issue my colleagues have mentioned, and that is there is a legal way to restructure the Secretary of State's department and USAID specifically. But what we saw on February 3rd was Elon Musk say, over the weekend, I tossed USAID into the wood chipper. That's a pretty profound weekend. It didn't involve consultation with Congress over the consequences. There was no rewriting of the law. There was no discussion of what funds could be delayed, frozen, redirected. And the result is different groups have estimated how many people have died to date and will die.
On the weekend of February 3rd, Elon Musk made a statement that sent shockwaves through political and humanitarian communities alike. He claimed, quite bluntly, that he had tossed UZ into the wood chipper. While the statement itself may have come across as metaphorical or exaggerated, the implications behind it were taken seriously across the board. UZ, the United States Agency for International Development, plays a vital role in delivering foreign aid, supporting global health programs, promoting democracy, and responding to disasters worldwide. Musk's remark was more than just a headline. It became a symbol of what critics described as a reckless and unilateral dismantling of one of America's most impactful international aid mechanisms. What made this statement particularly alarming wasn't just its dramatic tone, but the timing and context in which it occurred. There was no prior indication that such a major change was coming. Lawmakers, humanitarian organizations, and even members within federal departments were caught off guard. There was no announcement of a policy review, no consultation with Congress, and certainly no legislative or procedural steps that typically accompany restructuring a federal agency. Instead, what followed Musk's statement were abrupt cancellations of contracts, staff terminations, and sudden freezing of program funds. For many, his words were not just rhetorical, but confirmed a harsh new reality that took shape almost overnight. Observers around the world took Musk's words seriously because they coincided with real administrative actions. Even if Musk himself didn't execute these decisions directly, the timing of his statement and the subsequent dismantling of UZ programs made it appear as though he had significant influence. His involvement, or at least his public support, gave weight to the perception that this wasn't just a bureaucratic reorganization, but a bold and controversial move made with intentional disregard for the global implications. Media coverage amplified the story, humanitarian leaders raised alarms, and public health experts began to predict severe fallout. In political circles, the statement sparked intense debate. Was Musk merely voicing support for actions already in motion, or was he actively involved in directing these changes? Regardless of his precise role, his words gave a face to the disruption and made him a focal point of criticism. Many lawmakers demanded accountability, questioning how such a powerful message could be shared without oversight, discussion, or input from elected officials. The statement, simple as it was, became a lightning rod for wider concerns about unchecked influence and the dismantling of programs that serve millions of people across the globe. What made Musk's comment so consequential wasn't just the content, but the authority behind it. When a figure of his stature makes such declarations, they resonate far beyond the digital world. In this case, the consequences were tangible and immediate. Contracts were halted, programs were paused, and the international aid community was left scrambling for answers. What could have been interpreted as hyperbole instead became a chilling declaration that marked the beginning of what many called a humanitarian rollback. In just a few words, Elon Musk's statement captured a crisis in motion and sparked a global reckoning over the future of U.S.-led foreign aid. The dismantling of UZ programs did not follow the traditional legal or legislative process that governs such major actions. In the United States, the restructuring or defunding of a federal agency, particularly one as impactful as UZ, typically involves a structured approach, beginning with internal reviews, followed by consultations with congressional committees, hearings with experts, and potential revisions to existing laws. This ensures that significant policy changes undergo scrutiny and that decisions reflect a broad understanding of their potential consequences. However, in this instance, none of those steps were followed. The decisions were executed abruptly, without public notice and without congressional input, which led many to question the legality and ethics of the entire process. When the weekend of February 1st and 2nd came and went, what followed was not a formal announcement of policy revision, but instead a series of sweeping actions. Contracts were canceled, program funding was frozen, and staff associated with UZ initiatives were terminated. All of this happened in a matter of days, without any known briefings to Congress or engagement with foreign aid stakeholders. Lawmakers expressed outrage over being bypassed, stating that decisions of this scale, especially those with life and death consequences, must not be made unilaterally. This lack of transparency raised alarm bells not just in Washington, D.C., but around the world. Humanitarian organizations that rely on UZ's support were caught off guard, with some having to halt operations midstream due to frozen funding. There were no contingency plans or transition periods provided, leaving countless aid workers and program beneficiaries in limbo. Health programs addressing diseases like HIV, tuberculosis, and malaria suddenly found themselves without the financial backing they had long depended on, jeopardizing years of progress and infrastructure. The absence of due process also removed any opportunity for expert analysis or public debate. When major policy shifts are discussed through formal channels, it allows stakeholders, ranging from medical professionals to development economists, to weigh in on the potential ramifications. It also allows Congress to evaluate the constitutionality and strategic soundness of the proposed changes. By cutting out this process, those responsible for the decisions denied the public and its representatives the ability to assess whether these changes were justified or reckless. In testimony following the fallout, it was confirmed that no legal adjustments had been made prior to the termination of contracts. This means there was no rewriting of laws to authorize the shutdown of programs, which would typically be required in such cases. Instead, these actions were taken as if the standard rules did not apply. Critics argue that this set a dangerous precedent, where critical government functions could be dismantled on the whim of individuals without oversight, without accountability, and without the checks and balances that are foundational to democratic governance. The disregard for procedure wasn't merely an administrative oversight. It was a fundamental failure of governance. In sidelining Congress and ignoring legal frameworks, the actions taken not only undermined the legitimacy of the changes, but also raised questions about the future stability of U.S. foreign aid policy.
And will die over the course of a year or a prolonged period as a result of the destruction of the weekend of February 1st and 2nd. Did Elon Musk have your support in putting USAID into the wood chipper?
Well, I don't think that's a X post, or I guess you're imagining a social media post, is not a government
Not at all. That's a quote. That's what he said.
Yeah, that's okay. Well, that's what he said, but that's not ultimately what happened as acting director. Is all these decisions
Did
have to
his
come to
actions
me.
have your full support
The ones that I signed off on, yes, which is the ones that
of
happened.
what
because I
Elon
was-
Musk did with USAID?
No, but understand, these are contracts. All these
Did he do it
contracts.
without or with your support? That's what I'm trying to understand.
Well, not
Because
my support, it was my
team,
actions.
his Doge team did a lot of cancellations very, very quickly, and it fired a lot of people. It wasn't clear to me whether that had your
No,
support or not.
the Doge team didn't do anything. I did it. I was the one that made the decisions. I went through contracts, literally spreadsheets, line by line. I remember being in a hotel, I believe in Guatemala, going through line by line on spreadsheets of contracts that were canceled, contracts that were approved, contracts that were amended. These are all contracts.
So the Boston School of Public Health has a kind of a website where they post their estimated deaths as a result of the actions that were taken to dismantle USAID. And they're updating it continuously. So you go to it, the numbers keep changing. They have a one-year estimate, but they also have what they estimate has happened to today. And as of today, they estimate that the actions taken in putting USAID in the wood chipper, child malnutrition, 53,500 more deaths. And I'm rounding off because the numbers are continuously changing. Child diarrhea, 45,400 more deaths. Child pneumonia, 59,200 more deaths. Malaria, 25,100 more deaths. So what happened that weekend has resulted in the death of hundreds of thousands of children, and the estimate for the end of this year is much, much higher.
The humanitarian impact of dismantling UZ programs has been described by experts as potentially catastrophic. Almost immediately after the shutdowns began, public health organizations and academic institutions began tracking the ripple effects across developing countries. The Boston School of Public Health, for example, created a dynamic platform to estimate the real-time toll caused by the abrupt cuts to UZ, supported health programs. Their findings were grim. They estimated tens of thousands of additional child deaths from preventable conditions like malnutrition, diarrhea, pneumonia, and malaria. These numbers weren't speculative. They were grounded in historical data, predictive modeling, and trends from prior health crises when foreign aid was interrupted. As the data rolled in, it painted a bleak picture. Over 53,000 additional deaths from child malnutrition alone were reported as likely outcomes. Diarrhea-related deaths among children were projected at over 45,000, and pneumonia, another preventable disease, was predicted to claim nearly 60,000 extra young lives. Malaria, too, would surge with over 25,000 projected deaths. The tragic part of these numbers is not just their scale, but their preventability. These are diseases and conditions for which low-cost interventions exist: clean water, mosquito nets, nutritional supplements, antibiotics. What they lacked now was funding, and the sudden absence of UZ's support meant these life-saving resources were no longer reaching the people who needed them. These aren't abstract figures. Every number represents a child whose life could have been saved if the necessary aid had continued to flow. Families in rural communities, clinics in underserved regions, and humanitarian workers on the ground were left helpless as funds were frozen and programs halted. The result was a massive disruption of critical health services, the closure of outreach centers, and widespread shortages of medication and essential supplies. It was a chain reaction that unfolded rapidly, and for many of the most vulnerable populations, it came without warning. In addition to the immediate loss of life, the long-term consequences are expected to be even more devastating. A study published in the journal Nature, supported by data from global health institutions, warned that these cuts could result in over 15 million deaths over the next 15 years. The causes ranged from untreated HIV and tuberculosis to widespread malnutrition and waterborne illnesses. The study also estimated that 14 million children would be orphaned due to the sudden breakdown in health care and support systems. These children, left without parental care or government safety nets, would be at higher risk for exploitation, trafficking, and lifelong poverty. For many global health experts, the abrupt dismantling of UZ was not just a policy misstep, it was a humanitarian crisis in motion. The scope of suffering caused by these decisions, executed without sufficient analysis or transition planning, demonstrated how interconnected the world has become. When U.S. aid is pulled without preparation, the consequences are felt far beyond American borders. In this case, they reverberated in the form of tens of thousands of preventable deaths, and possibly millions more in the years to come. ChatGPT said, "A significant point of contention in the aftermath of the UZ shutdown is the ongoing dispute over the accuracy of the data being presented by public health experts and global organizations. While academic institutions and humanitarian research bodies have raised alarm over the projected death tolls resulting from the abrupt cut to U.S. foreign aid, government officials involved in the decision-making have pushed back hard. They claim that these estimates are grossly exaggerated, based on worst-case scenarios, and do not reflect the current state of program operations. This clash between expert analysis and administrative defense has deepened the controversy, leaving many confused about the real impact. Those defending the cuts argue that the numbers, some projecting over 15 million additional deaths in 15 years, are based on unrealistic assumptions. They contend that the models used presume a complete and permanent freeze in foreign aid funding, which they say is simply not true. According to the officials, a significant portion of aid programs, particularly those tied to the President's Emergency Plan for AIDS Relief PEPFAR, remain functional. They assert that 85% of recipients under those programs are still receiving care and treatment, suggesting that the system is not as broken as critics claim. From their perspective, while adjustments and reductions have been made, the core of U.S. foreign aid remains intact and operational. On the other hand, research bodies such as the Boston School of Public Health and respected journals like Nature maintain that their projections are based on available evidence and current trends. Their models factor in not only direct service delivery, but also the disruption to medical supply chains, community-based outreach, workforce layoffs, and the collapse of local partnerships. When aid is interrupted suddenly, even if not totally frozen, the systemic shock can result in long delays, logistical bottlenecks, and confusion in the field. These secondary effects are often not accounted for in official government statements, but are critical in understanding the full impact. Moreover, critics argue that the government's assurances lack transparency. While officials insist that the majority of programs are still running, there is little public data to verify these claims. Reports from international aid organizations suggest that on the ground, the situation is far more dire than what is being communicated by the administration. Clinics report drug shortages, workers are being laid off, and treatment for diseases like HIV, tuberculosis, and malaria has become inconsistent in many regions. These first-hand accounts support the broader projections being presented by global health researchers. The core of this dispute lies in differing interpretations of what constitutes a shutdown. While officials may see partial cuts as manageable, those working in fragile environments see them as devastating. Even a 10% funding reduction can mean the closure of an entire treatment center in rural Africa or the suspension of a critical vaccination campaign in Southeast Asia. Ultimately, this disagreement highlights a fundamental disconnect between policymakers and practitioners. It also emphasizes the need for transparent, verifiable data to inform future decisions, because when lives are on the line, clarity is not a luxury, it's a necessity.